The challenge you have in this part of the world, and it's a common challenge, is the fact that academia exists in their own space, the business community exists in their own space, and policy, government exists in their own space, and the community is completely ignored. So the community is seen as a net consumer of all the mess that is made out there across the three big boys, academia, policy, and the providers or the businesses. I think that needs to change because each of these players can actually play a role. The entrepreneurs often know what needs to be done and how to do it more effectively, but they may not always know how to generate stories of impact or figure out areas that they can actually tinker with for higher impact within that journey. Policy needs to respond by creating a better environment that allows the businesses to thrive. But also policy needs to create a better environment that allows whatever academia is generating to actually play a direct impact or impact how the laws are developed, how regulations come about. Ultimately, strengthening the ecosystem, and I think this is where Open Fences perhaps plays a very important role in my view. It's not a very academic or technical exercise. Strathmore and other institutions are very strong. They are capable of doing the technical work. But somebody just needs to think about bringing people together across specific agendas and actually helping to co-create solutions that can then be supported through academia and through policy. And I think the importance of that knowledge broker becomes very important where Open Fences sits.
Our journey to supporting ESOs did not start with a focus on ESOs. It started on a focus on entrepreneurs. So originally running direct programs as Bridge, a social enterprise, focus on catalyzing innovation at the very grassroots level. Initially through direct programs where we take in entrepreneurs through a business development program, and then they join an alumni collective. That business model evolved over time to zooming out to the supporters of entrepreneurs, focusing on ESOs, initially in the Central and Latin American market, because we're headquartered out of Madrid, and right now with a concerted and very deliberate effort to move into Africa with a program that we're calling Connect to Africa, that is looking to bring together 25 ESOs from 3 different countries, Kenya, Rwanda, and Nigeria, to collectively, simultaneously launch the most ambitious incubation program the region and the continent has ever seen, where we're focused on healthcare, and the 25 ESOs will be able to incubate early stage innovation at the very, very, very grassroots level, and we're going to track the impact of that program over a period of 3 years, working with Strathmore, a Harvard institution of great repute, and hopefully be able to translate some of the outcomes into real impact as far as delivery of primary health care is concerned, and how that translates to bettering people's lives at the very grassroots level.
In terms of inclusion of entrepreneurs in policy making or in implementation, I think entrepreneurs currently are recipients of what government makes, and it takes organizations such as the Kenya Healthcare Federation and other associations to support policy making, where they give in their inputs to be able to support government in policy making. However, the policy and the regulatory space has not been very supportive of the local entrepreneurs, especially in the health sector, or even when you do have incentives or where you have policies that are driven to supporting health entrepreneurs, they are not communicated effectively, so many do not take advantage of such.
On a day-to-day, we work with entrepreneurs across various sectors. One of the things we support them with is just to help them upskill them in their entrepreneurial journey, help them to understand business, even as they come in with products, either tech products or just ideas that they have. So most of the time they have done their research in terms of what they want to do and looking at the market, what exactly they want to take to market. But they do not have the entrepreneurial know-how of how to conduct business and go to market. How we help them is to help them capacity build in terms of understanding their entrepreneurial skills. Yeah? They've come with an idea, but how can this idea be transformed into a business? So we help them with the whole cycle of ideation, prototyping, and go-to-market strategies.
Let me start with the latest. We have the recent changes in the global healthcare funding architecture with the sudden and unexpected reduction in development agency funds for healthcare. But before that, we also had many funding agencies in Europe beginning to talk of shifting from aid to trade. Yeah, that has been a discussion that has been going on for many years. So the latest move, for example, from the US government, for me, I see it as a continuation of that thought that started, that we need to move from aid to trade. Some people are worried about the reduction in funding, but others are seeing opportunity in that if we shift the funding from aid to more of trade, to more of business, it is good for startups because they work like businesses. They want to be efficient, they want to use funds efficiently to deliver greater impact, as opposed to the older development model where the focus is on burn rate of funds, because there's a huge pile of cash and you are chasing some change in the market. But the startups and entrepreneurs and innovators start first of all by providing value and solving a problem, and then look for the funds.
We are now in a context where financing is really, going down, drying up a little bit. So I'm thinking about it from what is the sweet spot for development partners in catalyzing, that, or strengthening the investment pipeline for startups in healthcare. And probably drawing from an example of what we do, there's a lot of risk, of course, involved in startups, and building having a viable business model, all the way from idea to ideation to the marketplace, and many risks involved. And I think a role that could be played through development partnership is de-risking those early stages, and that's what we are doing through our lead customer program, where we work with early stage innovators, of course with a fairly advanced TRL level, tech readiness level, where the idea is almost commercially ready, and working with them and partnering, having that UK-Kenya collaboration, but also introducing a lead customer and catalyzing that, supporting that, funding that. That way now, coming out of that, the innovator is able to, has now market access, can kick off, and at that stage, typically the startup can actually attract external financing. So I think there's a sweet spot there that development funding could do to de-risk those early stages of startups in the healthcare space.
First, as a country, I think we need to invest in research and innovation. A lot of our startups have relied on external funding, and we can see a lot of changes with that. So as a country, we need to step up. We need to put in money in our budget to fund healthcare innovation and healthcare research, so that we give these startups and innovations an opportunity to scale, because more often than not, it's very hard at the beginning to get sufficient capital as an innovator. But if the country invests in startups, then they are likely to progress to scale, and they are likely to be more sustainable going forward. The other thing I can think about is improving the regulatory space, so that they are able to make startups, to give startups an easy time in terms of compliance with regulations. Another thing I can think about is the government should be a better business partner, because a lot of these startups, the government is actually the biggest business in healthcare. They have 50% of the health facilities,
but a lot of startups struggle working with counties, working with the national government. They rarely take up their ideas, and when they take up their ideas, they don't pay because of challenges with the public financial management system. So if the government becomes a better business partner, then our innovations are likely to grow and become better. Finally, I can think about our relationships with other countries in the region. So I think our government needs to work on regulations that improve our relationships with other countries, so that our startups can actually have market access to countries like Uganda, Tanzania in the region, because more often than not, for them to be sustainable, they need bigger markets, and the region provides quite a significant market. So if we invest in better relationships with our neighbors and better business partnerships and trade arrangements, then they're likely to scale.